In this lesson, we're going to be talking about working with families. By the end of this course or this lesson, I hope that you'll be able to understand the role of families in recovery and understand the effects that drug addiction has on families, understand how families can provide enhanced support to recovering drug users, and understand the key elements of a supportive meeting with families. So let's first start by reflecting on how diverse family structures are in the United States. We have single parent homes, mom and dads, multi-generational households, same-sex couples, foster arrangements, adopted families, and every family is going to bring unique dynamics to the table. And addiction might play out differently across those structures. So understanding this diversity is going to help us approach each family with sensitivity and avoid this one-size-all-fits solution of it's the standard typical mom, dad, 2.5 kids. So as counselors, our role is to ask, how does this specific family system affect the client's substance use? And how can we work with that system supportively? So asking the right questions about their dynamics, their history, their communication patterns, that's going to open up the doors to collaboration and trust building, which is going to be essential for their long-term recovery. So not all family involvement is going to look the same. Some clients may want very little interaction between the counselor and their family, while others are going to benefit greatly from deep integration. So there's 5 levels here. We have from basic communication to full family therapy. And this is going to offer a framework for determining what kind of involvement is appropriate and also therapeutic. So as you're working with these families, you need to assess whether your role is to simply educate or offer emotional support or maybe facilitate some formal interventions. And remember, some families may have unresolved trauma or dysfunction that's going to require referral to specialized family therapists. So knowing your boundaries and scope is going to be key to being effective without overextending. So a level 1 would be the counselor has very little or no involvement with the family. A level 2 would be the counselor provides information and advice to the family, advising families on how to handle the client's needs. Or for large or demanding families, communicate through 1 or 2 key members, and then also identify major family dysfunctions that are going to interfere with the drug addiction treatment and refer that family for specialized family therapy. Level 3 would be like the counselors providing the family with psychosocial support. So we want to elicit and empathize with the family members' concerns and their feelings that are related to the client's condition and effect on their families. Conduct preliminary assessments of the family's level of functioning as it's relating to the client's issues, support the family members to cope with the situation, tailor the drug addiction education to the unique needs, concerns, and feelings of the family, and identify family dysfunction and appropriate referral recommendations. A level 4 would be the counselor provides systematic assessment and interventions, and level 5 would be family therapy. A common misconception is that working with families automatically means that you're providing family therapy. In reality, family therapy is a structured and often long-term clinical process that addresses the entire family system. But on the flip side of that, involving families in addiction counseling often means just using educational and supportive approaches to increase the family understanding and participation in the client's recovery. So the main distinction is going to lie in the treatment unit. In addiction counseling, the primary client is going to remain the individual with the substance use disorder. And in family therapy, the entire family becomes the client. So recognizing the difference is going to help us clarify our roles and avoid any scope of practice issues. So when done appropriately, involving the family in treatment is really going to significantly improve the outcomes. Families often have insights into the client's behaviors, and they can reinforce the treatment goals that we set for the client at home. And then the family is also going to be able to provide emotional support. And so for clinicians, it can mean reduced resistance and just greater transparency in therapy. But this approach isn't suitable for all families. Some members may have untreated substance use issues themselves, or there may be histories of abuse or deep dysfunction that's really going to just complicate the involvement. So the clinician has to assess, how ready is this client? Any safety concerns? And what might be some of those potential benefits before moving forward with the integration? Now, keep in mind, this is not for all families. Family members might have serious drug-related problems. The client may have been abused by the family member, or there may be significant problems in the family relationships. And so this may require additional skills, or there may be a lack of structure there. So that's going to limit you in your ability to service these families or the client themselves. So obviously we want to start by providing counseling sessions for the client first and kind of figure out what are the client's problems before we start to integrate in the family. Then we want to identify any family-related issues. So is the client having problems with or seeking support from family members? Then we want to explore what kind of support the client wants from their family. And then we want to identify what are our client's expectations about meeting with their family. And then we want them to identify who they would like to participate. And then we can discuss the client's plan to work with their family. So when planning to involve the family, the process should begin with a clear understanding of the client's issues, how their family fits into those challenges. It's going to be important to ask the client how they perceive the family support, who they would like involved in the process. Their preferences and boundaries are going to guide our every decision. And then once the meeting is deemed beneficial, set the expectations early. Structure is essential. We have to have a defined agenda. We need to prepare our clients in advance, clarify the purpose of the meeting, and that's going to ensure that the discussion remains focused and respectful and therapeutic. We don't want it to become confrontational or chaotic. So structure each meeting by setting an agenda, define the meeting contents based on an analysis of the client's needs and expectations. Then we can contact the client's family members for an agreement on the meeting plan, like who's going to participate, where are we going to do it, what time, what's the content of the meeting about. Then we can decide who will be the local contact person for that meeting. And setting ground rules is going to be essential for family meetings to be productive. They're going to help manage the expectations and prevent any emotional escalations, and really just foster an atmosphere of safety and respect. We want to emphasize confidentiality, mutual listening, and the importance of staying present focused rather than dwelling on any past grievances that they may have. Another element is helping families understand how to give constructive feedback. A lot of them don't know how to do that. So start with what worked well and then discuss what can be improved. So we want to end this on a hopeful but affirming note, and that's going to set the tone for future interactions and promote healing. So let's talk about the goals here. Clear goals are going to give both the client and the family a roadmap for change. Goals should include acknowledging any past struggles, building awareness of addiction and relapse, maybe rebuilding some trust, enhancing the communication. These goals need to be shared and mutually agreed upon. The families are not just observers. They are the change agents. And when they feel heard and respected, they're more likely to engage in that process. So helping the families understand cravings, relapse cycles, and behavior change can really remove some shame and blame and replace it with empowerment. So we want to acknowledge what the family's gone through, educate the family about any drug addiction and also change, educate the family about cravings, lapses, relapses, rebuild the trust between the client and their family, build effective communication strategies, support and reward safe behaviors, setting limits and enforcing consequences, and then, of course, encouraging them to spend time together. So let's talk about meetings with families. So the first session with the family is going to be pivotal. This is going to be the time for them to build rapport, normalize their feelings, start teaching communication skills. So what we want to do as clinicians is encourage I statements. We want to encourage active listening skills and validation so that we can reduce the reactivity and improve the emotional safety in those relationships. So we want to avoid jumping into problem solving too quickly. Instead, we just want to spend some time understanding the family's concerns and offering education about addiction as a chronic condition. And that's going to help shift that conversation from blame to support and from shame to collaboration. So it's going to be important to just enforce the one person speaking at a time rule, teach them how to do the I statements, positive specific requests, make sure that they're specific, teach them how to do active listening and validation for the other person. And this is just going to give us an opportunity to help them work out ways to support the client and help the client to avoid blaming the family. We want to keep everybody informed of what's happening, give everybody a chance to voice their concerns and their needs for the future, but we don't want to impose any fixed solutions that might not work for every family. And families often don't understand how behavior change actually works. So help them recognize that recovery is not a straight line. It involves planning and setbacks and learning and adaptation. So talking about relapse prevention and some common obstacles, and also informing them about change models is going to create this realistic framework for the families to start working within. So as you're discussing change, reframe those conflicts as opportunities for growth. Use reflective listening, use summaries so that you can clarify any feelings and highlight areas of agreement. And that's going to promote progress and reduce the defensiveness. And trust is an issue here. So it's often shattered in families that are affected by addiction. The rebuilding process is going to take time and consistent action. So encourage each person to express their concerns and just acknowledge any positive changes that have already been made. Conflict is inevitable, but how we handle it is what's going to make the difference. So shift from the problem-focused to the solution-focused questions and encourage the family members to validate each other's intentions, even when the behavior has been hurtful. And that's going to set the stage for really long-lasting relationship repair. So there's a cycle of blame between parents and children that can really be powerful and paralyzing. So this slide illustrates how one party's well-meaning actions can be misinterpreted, leading to defensiveness and then resentment and then relapse. So breaking this cycle is going to require empathy and a new communication strategy. Rather than using guilt or control, we can help the families reframe their motivations and redirect their actions towards encouragement. And that's going to set realistic expectations and recognize their effort. So as you can see here, the parent is aware of the high risk situation and thinks he needs me to remind him of the risk. And so the parent raises past breaches of trust. And then the young person is going to think, oh, she's never going to trust me. I might as well not try. And then the young person is going to enter the high risk situation or has a lapse. And then the cycle goes around and around and around. So the families need tools, not just insight. So we could start by helping them brainstorm some safe and risky situations. And that's going to promote awareness and gives the family some concrete ways to support the client without being overly controlling. Balance is key here. The families must both protect and empower. Supporting that safe behavior might mean helping the client find healthy hobbies, attend meetings, or structure their day. Giving the client space to make those good choices while having support systems in place is going to help build that confidence and reduce the relapse risk. So what we can do is help the family develop a plan and some strategies that are going to promote participation in safe situations, reduce the involvement in risky situations, then review the progress and make adjustments accordingly using a problem-solving approach. Limit setting is not punishment, it's guidance. The most effective consequences are those that are understood, agreed upon, and consistently enforced. So harsh, inconsistent, or developmentally inappropriate limits are going to backfire. So involve the client in setting the rules, and that's going to ensure buy-in, and it's going to increase the likelihood of success. Remember, the goal here is not control. It's fostering accountability and safety within that recovery environment. So consequences should be clearly stated, applied consistently, developmentally appropriate, and acceptable for the client, or this says young person, it could be for the young person or for the client. It's not going to work without the client's agreement, and it should not be overly harsh. We want to make sure that we are reconnecting through shared activities, and that's going to help families rediscover joy and build some positive memories. And it's also going to help them to shift that focus away from their addiction. So we need to encourage the families to reflect on what they enjoy doing together and how they can prioritize that more often. Quality time is often what strengthens the bonds and heals the wounds. And it doesn't have to be elaborate. Cooking, playing games, walking together, all that can be really powerful. The key is going to be consistency and intention. So families play an essential role in relapse prevention. So we want to teach them how to spot early warning signs, including like mood shifts and behavior changes. And we want to encourage the clients to self-report when they can and frame the relapse monitoring as a support system, not a surveillance program, because they can often feel like they have probation or parole officers at home. Managing relapse is a learning opportunity, right? It's rather than just a failure. And when we reframe it as a learning opportunity, it's going to reduce the shame and increase that long-term success. And when the families understand this, they're going to become more resilient and less reactive during those setbacks. So we want to give options for monitoring those lapses and relapse. Self-disclose, identify and respond to early warning signs, identify behaviors and moods, which can be an early warning sign, and just random check-ins. Reframe as supportive rather than punitive, and just remember that it's going to be hard for families to respond to lapses and relapses without conflict. So explain that it is natural to feel disappointed about those lapses. So each session should end with the hope and clarity. Summarize what went well, highlight any progress, outline the specific steps that each person is going to have to take before the next meeting, and that's going to help maintain the momentum and the accountability. If there's any homework like journaling or attending a meeting or practicing communication techniques, ensure that the expectations are realistic and agreed upon. Closure is going to bring a sense of completion, and it's going to reinforce the structures that the family often craves. So in families that are impacted by addiction, certain roles are often going to emerge, such as the enabler or the scapegoat, the hero, the lost child, the mascot. And understanding these roles is going to help family members see how their behavior, even if it was well-intentioned, is perpetuating the dysfunction. So this insight allows for movement toward the healthier dynamics. So by naming and discussing these roles, families are going to start to shift out of those rigid patterns and into more supportive and functional ones. And I will make sure that this is explained in one of the next videos in this lesson. So you can do a family counseling role play. There's 5 roles: the counselor, the client, the mother, the brother, and the uncle. It should take you about 40 minutes to do this, but the objective is to discuss current problems of the client, agree on a plan that can help clients stay away from heroin with the strong support from the family members. And we want to provide the family members with information about stages of change, the difference between slips, lapses, and relapse, and how to support the client. So we want a specific plan to which everyone is agreeing. You can do this with others, or you can do this with ChatGPT. Put these parameters in there and ask ChatGPT to play the other roles as you play the counselor. So you can also put this into ChatGPT. The background is Mike is a male. He's 18 years old in 12th grade. He is a single person living with his mom and his brother. The father has passed away. The family is poor. The mother runs a street-based shop, and the brother works outside to earn a living for the whole family. So Mike has started smoking heroin at 16. He changed to injecting 1 year later. He has not shared needles or other devices. He injected 3 times a day, about $10 to $50 a day before treatment. His HIV status is unknown. Currently not using drugs for 2 months, as he was forced to quit by his family. And so he quit by staying at home. The mom takes care of the client the most. She doesn't allow the client to go out to hang out with his friends. The brother also cares for the client, but often blames and shouts at the client, thinking that it's going to work. And he's the main supporter of the family. And he thinks that he, the client, doesn't know how hard it is to earn a living. So we had to be strict about his drug use. We took him to a detox center for treatment because we suffered enough because of him. And the father died because of him too. The uncle has significant influence on the client's family, especially the brother. He's psychologically supporting the client's family after the father died. So the client is in conflict with his brother regarding how to deal with his addiction to heroin. His mom doesn't want to send him to the detox center for treatment, but she's confused about how to control his drug use at home. He's suffering from cravings, and these are going to worsen due to the troubles with his brother and his mom. So conduct your role play. You have about 20 minutes to do this role play, and then you can come back. So I want you to think about what were some of the strengths of the plan that you created with the family. What might be some potential challenges? What were some issues that arose during the role play? What were the conflicts? What was the lack of communication? The breach of the ground rules? What else happened? How did the counselor handle these difficulties? What could have been done differently, and how could you have done it differently? I want you to answer these questions on your own sheet of paper. Family involvement in recovery is powerful, but it has to be done thoughtfully. So when families are informed and supported and included with clear boundaries and ground rules, they can become allies in healing rather than obstacles. So as clinicians, our role is to guide this process with compassion and structure and a focus on the future. Even in families with a painful history, change is possible. And when families heal together, recovery becomes more sustainable.